Namaskar to honor the World Health Day, which is celebrated on 7th of April, and to bow down to our all doctors and the fraternity across the globe and in India for their contribution in the era of pandemic. And to discuss the following situation in the country and around the globe, we have got Dr. Sunali Khanna with us. She's currently head of the Department of Oral Medicine and Radiology at Nair Hospital Dental College, Brihanmumbai Municipal Corporation. Apart from that, she is a vice president of Indian Academy of Oral Medicine and Radiology, and also she is a member of National Academy of Medical Sciences. And lastly, she has been a president of Asian Academy of Oral and Maxillofacial Radiology from 2016 to 2020. Ma'am, बहुत बहुत शुक्रिया हमारे साथ जुड़ने के लिए. Thank you so much for joining us. Of course, tomorrow, rather, I would say on 7th of April is a very important day. And respecting all the doctors of the country and around the globe, I would like to congratulate you. The work doctors and the fraternity in the medical sector has done during the pandemic. And my first question to you in the regard is that as the World Health Day is celebrated in all continents to help government and policymakers to refocus attention on the health issues, particularly of the urban poor and those living in remote rural areas. So where we are and how we are progressing today. Please, what would you like to say?
Good evening, everyone. Thank you so much. And today we gather to commemorate the World Health Day, celebrated annually on 7th April. This year, the theme is building a fairer and healthier world. India's healthcare system is a vast and complex ecosystem comprising of both public and private sectors. However, despite progress, we face several challenges even today. Access to healthcare remains uneven, health disparities are glaring, uneven quality of care varies, and for many, the healthcare expenses itself can be very prohibitive. Now, fortunately, the Indian government has undertaken various initiatives to address these challenges. So, programs like Ayushman Bharat, the National Health Mission, especially the rural, and Pradhan Mantri Jan Arogya Yojana aim to improve healthcare access and affordability for all citizens alike. Now, while these efforts have shown promise, there's still a lot of work to be done at the primary healthcare level and, rebuilding, rebooting the public health infrastructure, especially in the rural areas for the marginalized sections of society, the vulnerable population, the specially abled population, and let's not forget India is a graying nation. We have the geriatric population to look after. So I think these are the core areas we need to look into.
Ma'am, I would like to ask you, I was going through one of the government press releases in which the current government of India that informing that through Ayushman Bharat, about 80,000 crore rupees of the poor patients are saved due to free treatment under the scheme. And apart from that, I would like to read out about the Jan Aushadhi Kendras as well. 9,000 Jan Aushadhi Kendras have saved about 20,000 crore rupees of the poor and middle class all over the country. So how do you see these initiatives? They are seen as a baby step or on a large scale? How do you see it?
So I think these are not baby steps at all. These are very bold and very firm steps, which I think are going to go a long way in rebuilding public health infrastructure. Because as far as prescribing generic medicines, that's also something we need to face reality. We need to start doing it at a regular basis. And government hospitals, especially municipal hospitals, we are so well beefed up with our system of providing in-house medicines, in-house treatment, customized protocols, that I think the others have to possibly also come at a sort of a leverage and decide what is good for our population and continue to endorse that. So I think these go a long way in reducing the costs and also addressing the cost versus benefit ratio. So in many diseases which are non-communicable, like cancer treatments, in chronic renal disorders, chronic sort of neurological debilitative disorders, the patients, the people have to undergo treatment for a very long time. So when it's long drawn treatment, obviously the costs go up. And we have to understand, as I just said, we are a graying nation. We have a lot of geriatric population. So the patient is kind of already suppressed with the fact that he has a long way to go and whether he'll be able to sustain treatment. So I think that is one thing as a society we need to sort out, that it should be available at a particular rate, at a particular comfort level, which should not really burden the sort of population that we're looking at.
My question to you is, governments are like state and central government. So, what kind of collaboration you look at while working in the health sector? So, could you elaborate on this, please?
That the lab innovations, the cutting edge research has to be translated to the common man, and it has to be clinically applicable. For that, we need technology, we need the biomedical scientists, we need the clinicians, surgeons, doctors to come together. So if we have looking at say cancer therapeutics or some surgical protocols, we may be implementing the best cutting edge research in the laboratory and in the labs, and everything is so possible. But to make it in an executable condition that it can be transformed into clinical applicability at the level of the hospitals, so that's where we need the collaboration. That's where technology has to come in line with the biological sciences and the basic sciences.
Ma'am,
So
if we talk about the One Health policy, looking at one nation, so are you in favor of that? What kind of policy you eye at?
So I think that's something that has to come. There's no way about it. We all have paved the way for it, and I think that's going to be ideal. The only thing would be like maybe some sort of a coming together or a standpoint where we do have some equitable choices where people can make regarding some, like if there are say fields in which you have some gene therapy, immune therapy, or cancer therapeutics, where the patient has to opt for some things which are not which have to be in terms of foreign collaboration or drugs from abroad or say protocols from abroad. In those conditions we can possibly leverage the want of those things and also customize them and kind of make them available to a poorer population as well. But in the other run, there is most of the things can be our strategy as usual, as it used to be in the past, should be the preventive strategy. So rather than the curative part of it, which is more expensive, I think it should be the preventive strategy works best, because at I think at that level you're able to sort most of the issues.
Ma'am, I would like to ask you, I was again going through some of the reports. Developed health and wellness ecosystem can be created in India only with Sabka Prayas. Sabka Prayas is not, as you also spoke, it's not about the professionals, it's about the citizens as well to come together. So, how do you see this?
So, well, I think Sabka Prayas is absolutely necessary because everyone has their, say. And I think that's only when, you collaborate with them as people and treat them holistically and work towards their holistic management. That is when you can address these problems. Because I may be giving the best treatment, but if the person does not have a lifestyle and does not have habits which will pull him through the next 20 or 30 years, my attempts are absolutely negated. And it's in fact the same population becomes a liability instead of being our asset. So especially the chronic diseases like the tobacco-induced diseases, etc., which hold people back in their productive age, the non-communicable diseases. Obviously, thanks to the collaborative effects of the patients, the doctors, the stakeholders, and the policymakers, that's when this effect would, take action.
Ma'am, I would like to put one point which I was recently going through some videos, and of course, it was from the Honorable Health Minister, Dr. Mandavi, I'm talking about. There was a lady in Himachal who took the polio drops all the way in the snow from door to door, to make sure that it is given on right time and to every child it is available. So if you're seeing this kind of health force, I could say, how do you see these kind of initiatives, what the government has taken, and how do you see the health sector now?
So I think the government's doing a brilliant job in enthusing the citizens to take major steps, initiatives. All the policies are working really well. Also towards youth awareness, we have to understand that the youth is heavily involved in their own, nation building procedure now, which wasn't really so much of a glaring reality earlier. So all these things are absolutely important because till they don't join the workforce, it's very difficult to percolate to the grassroots level. So initiatives like this should be encouraged, and they are also happening. And plus, COVID has been a huge teaching lesson, as I told you. People understood the power of their own self, and all the systems of integrated medicine, say the Ayurvedic, the Unani, the homeopathic, the allopathic, the surgical fields, everybody came together to find solutions for society. So there was.
I would like to interrupt, and of course, you have spoken about the Ayurvedic, the Unani part, and recently, I was hearing one of the speeches of the Honorable Health Minister, in which he's encouraging that the modern medicine and the Ayurveda research to go together, so that it is helpful for everyone. And how do you see those encouraging words?
So, in fact, we've been doing this for a while now, and interdisciplinary research, as I said, it's not only biotechnology with molecular sciences, genetics, and histopathology with, say, pathological sciences, and not only the clinical stuff, but introducing proposals where you include use of herbal products, their clinical applicability to patients. So where all the allied health sciences also join with the mainstream sciences, which is medical and dental, that's when you get integrated research and you get the correct outcomes. So the Prime Minister has time and again absolutely through even the Parliamentary Health Committee recommendations endorsed the introduction of MRUs, that is multidisciplinary research units in all medical colleges and dental colleges. So that's something where we need to work on. So once you have those sort of setups, obviously you will have a lot of allied health sciences come together with the mainstream, and the results would really show.
In the recent past, some sort of ease has brought into the MBBS examination system as well. So, are you happy with those kind of things as well, which the government has taken? These are
Yes, yes. I think they're all being streamlined, and that's all towards very, and it also instills a lot of self-respect for each other's fraternity.
National Poshan Mission. I repeat, National Poshan Mission is addressing anemia and malnutrition. How do you see these kind of missions?
So I think if you look at anemia and chronic malnutrition in developing countries, it's always been a concern. So we lost out on thinking too much about them because we started thinking more of infectious diseases. We had tuberculosis on our mind. We had HIV on our mind. In the middle, there was COVID. So now that the pandemic is over, I think people are getting back to the basic strengthening of the immune system, which strongly relies on the nutrition. So if you look at that, if you look at female health, if you look at maternal health and infant maternal mortality rates, etc., low birth weight, which has always been a concern in India, I think you cannot deny working on anemia, chronic anemia. And it's not only part of women's health also, it concerns the general population. And so portion and yes, basic micronutrient supplementation is important as well. So where we talk about macronutrients, we talk about the micronutrients, which is say the dietary iron, which we're talking about. So which is where anemia comes into play. And we have a lot of other micronutrients and metal ions which are also involved. So like copper, iron, manganese, magnesium, these are all required in a balanced diet. So I think now the focus is more towards building a healthier immune system, as I said, focus on the prevention rather than the treatment perspectives.
Very rightly said, ma'am. Of course, seeing our growing India, our global India, and in the current leadership I'm talking about, which has seen in the past 5 years, I could say, what kind of urban planning you see in the health infrastructure I'm talking about in India?
So I think urban planning, if we look at only the smart cities and the metros and all of that, we always have, say, the primary, secondary, tertiary health centers. We have research centers like medical colleges, etc. So that's all there. But we have to understand that we have the feeder hospitals, the primary health centers, which they, feed the research centers, tertiary centers. So in those, you have to have treatment modalities which are equitable to most of the people who are coming there. So the patients, and also building up in AI, building up in working with lesser amount of workforce deployed for the same amount that now can be churned out technologically. So I think those are the gaps which we need to fill. Once all that is done, we will have some amount of workforce which can be focused on our semi-urban and rural populations. Like we have a lot of schemes now where everybody after post graduation has to do a bond in rural areas. They have to do a rural posting, which I think is extremely important because it sensitizes them to the needs over there. And a lot of them also get back to their roots. So that is something which is important. And as far as urban planning is concerned, you have to have public infrastructure, which is beefing up. And at one time, I think we will come to the foreign concept of AI and the paramedical systems facilitating us so much that the actual amount of disease burden will be highly reduced. And I think as far as public policies in Mumbai, etc., are concerned, and the BMCs enforce them with so much of efficiency that even having affordable beds in private hospitals, having a sort of say in what you can afford, what was actually not affordable. So I think those things have made a lot of difference.
Ma'am, like you spoke about the BMC, and we were speaking about the central government, and of course, one is run by the state, and the other schemes we are talking about the center. So, ma'am, I would like to ask you that with the collaboration and seeing one government in the Maharashtra state, so how do you see the ease of running things in the medical sector?
So I think this is a new world. It's really changed. There's been a paradigm shift absolutely in the way we look at things, whether it is health informatics, whether it is data banking, whether it is safeguarding sampling, investigative protocols, and safeguarding the patient safety in terms of procedural things. So I think technologically we've come a long way, and we have a lot of accreditations which are coming into play, and that's beefing up the health infrastructure in the private and public sectors. So where a certain baseline amount of standards have to be followed for every patient. So it's not that it comes a long way in bridging the health disparities also. So I have some sort of an equilibrium in society for all echelons of society. So I think that's where the public bodies are doing a fabulous job.
My last question to you, of course, as I was saying before, also we are in a global India, more vibrant India. After G20, especially, the vibrance felt all over now. So, how do you see the world seeing India in terms of the medical sector? Of course, government of India is promoting the medical tourism as well. In Ayushman Bharat terms, I'm talking about. What would you like to say on that, please?
Well, I think seeing everything worldwide also in the current scenarios after COVID, and how the global scenario is changing in terms of how certain economies are functioning, I think India is the place to be. So while our attempt has always been to publicize and to showcase our traditional medicine, and I think the traditional healers had a huge role in old civilizations like the Indian civilization, and there's a lot to do with barefoot doctors in tribal areas, traditional healing practitioners. So this has always been part of us, and Ayurveda in terms of the food, in terms of the spices, in terms of the traditional healing practices which come out of the plant products, the herbal products which India is so proud of. So all those things have been an attraction always. This is only paving the way for a more structured medical tourism pattern. And I think that's the reason why we are going to be at the top of the global map.
I would like to mention last point as the theme of this time, the World Health Day is My Health, My Right. So your last liner on this, please.
So it's very important to say that my health, my right. We are equal participants in our healthcare system. So it's the citizens' responsibility also to help the government to enforce these schemes, to be participating in them, and as practitioners to be endorsing them, to be part of it, to be involved in collaborative treatment and research. And so it's a collective effort towards holistic health.
Thank you so much. This was Dr. Sunali Khanna,